Dear friends, I'm at the Diyafa Modern Medical Center in Jumairah in Dubai, and we have been looking at all patients who've got diabetes, especially those who are diabetics for more than 5 years. And we realized that Al Diyafa, a large number of diabetes patients in Dubai have got polyvascular disease. And when we talk of polyvascular disease in diabetes, diabetes is a heart attack equivalent. So all diabetic patients have associated coronary artery disease, and they also have other polyvascular disease, like it affects the eyes with diminished vision, and this is due to diabetic retinopathy. And also many of them could have a stroke, and this could be related to the plaque in the neck vessels, which we call carotid artery disease, and they may have symptoms of chest pain, which could be due to diabetic blockages in the heart vessels, which we call coronary artery disease. They may also feel breathless because many diabetic patients will have a reduction in the heart pumping, which is called diabetic heart failure. They may have kidney problems, which is called diabetic nephropathy, and their creatinines could be high and the GFR could be low. Many of these diabetic patients who have followed up with us at the Al Diyafa in Dubai, we have noticed they have peripheral arterial disease with pain in the legs when they walk, and this is called claudication. They may have associated nerve problem, which is called a peripheral neuropathy. So it's very imperative that all diabetic patients for diabetes more than 3 to 5 years should surely control their diet, especially with sugar and with rice and with white sugar, but also to control their blood sugar with various medications, including metformin, the SGLT2 inhibitors, GLP-1 receptor agonist, and the gliptins. With this, they should be investigated for a polyvascular disease, because diabetes is a silent poison. So it can affect the eyes, the brain, the neck vessels, the coronary arteries, the kidneys, the peripheral arteries, and the nerves. Hence, it's imperative that all diabetic patients should undergo a fundoscopy, should undergo a carotid artery scanning with a Doppler, a cardiac examination with a ECG, a 2D echo, a TMT test, and if required, a coronary angiography, and may also require a blood test for creatinine and also for eGFR, and their blood sugar control with a 3-monthly blood sugar, which we call HbA1c. They may need a peripheral Doppler to look at peripheral arterial disease and a nerve conduction study for a diabetic peripheral neuropathy. So as the American Heart Association and the ACC in 2019 declared diabetes as a heart attack equivalent, I would call it diabetes as a silent poison, which is a cardio polyvascular disease more than just a blood sugar disease. Thank you.